Yeah, so I'm not a cardiologist. Of course, I'm a psychiatrist, but the reason why I have learned so much about statins and think so much about statins uh, is because the brain is rich in cholesterol for a reason. So, what is all that cholesterol doing up there? So the brain is really rich in cholesterol because it is rich in membranes. So membranes, uh, there's a substance called myelin, which insulates all of our brain circuitry. Essentially, myelin is just tightly coiled membranes wrapped around our electrical connections inside of our brain, and they are myelin is very important. Without that insulation, nerve signals wouldn't be transmitted quickly enough or safely enough. You get a lot of short circuiting within the brain. So myelin is just tightly wound membranes, and membranes are rich in cholesterol. That's just one reason why we need a lot of cholesterol in the brain. Cholesterol it forms it is helps guide developing nerve endings to their final destinations when the brain is developing or when new connections are forming. Cholesterol is really important for the synapse where the synapses where brain cells connect with each other and where they're trying to communicate with each other. Cholesterol plays a very important role in synapse function, in brain cell communication. Lots of other the membranes that wrap mitochondria. Mitochondria do many important things, but one of the things they're most famous for is generating energy. Mitochondria have not just one membrane, but two. They're a very special double membrane system. And those membranes require lots of cholesterol. So the brain needs a lot of cholesterol. And so cholesterol isn't just something bad to be bludgeoned into submission with a medication. Cholesterol is a vital molecule, essential for all cellular life. So all of our cells require cholesterol. So now what's really fascinating about cholesterol is that the molecule itself, cholesterol, is too big and bulky to cross the blood-brain barrier and enter the brain. So the brain must make every single molecule of cholesterol it needs itself from scratch. So I like to say, why would the brain go out of its way to make to make a molecule that's bad for us? It wouldn't. It's really smart. It's a brain. It knows what it's doing. The problem with statin drugs is that all of them, to a greater or lesser extent, it depends on which one we're talking about, but all of them cross the blood-brain barrier. All of them interfere with cholesterol production in the brain. All of them. And I've had many patients over the years who have started a statin medication based on the advice of their cardiologist or their primary care doctor, who have been trained to look at LDL cholesterol on a lipid panel. Unfortunately, zero in on that number and almost to the exclusion of all else, and think, oh, that LDL is too high, you need a statin medication. They prescribe the statin, the patient starts the statin, and within days, and this has happened more times than I can count, so I'm absolutely convinced this is a real phenomenon. They start to have problems with their memory. They start to have problems thinking clearly. They start to have problems with word finding. I cannot tell you how many patients I have worked with who they start the statin, they start to have the struggle with finding words, being articulate, remembering things. They're just just a little off their game, right? These are sometimes people in their 30s and 40s. Stop the statin, their mind clears up within days. Start the statin back up again, the cognitive impairment occurs again. This is a very real phenomenon. And so it makes sense if you think about it. The way statins work is they turn down the enzyme, the activity of the enzyme responsible for building cholesterol molecules. If the brain can't build cholesterol molecules, it's in trouble. It needs to be able to build cholesterol molecules. You don't want to interfere with that. Statin medications have almost no, there's the science behind statins and heart disease prevention is extraordinarily weak. For whatever questionable, minuscule benefit you might be getting from a statin in terms of your cardiovascular risk, that tiny potential questionable benefit is offset by a tremendous amount of risk, not just to brain health, but to the health of all of your cells. All cells need cholesterol. And I think it's quite important to understand this, that statin drugs increase your risk for type 2 diabetes. This is very well established. Type 2 diabetes is very dangerous for your heart. It's a very powerful risk factor for cardiovascular disease. And so you're getting much more risk than benefit. Now, as a psychiatrist, I can't deprescribe somebody's statin medication. That would be beyond my scope of practice. But I can educate my patients and attempt to share this information and the science and all of the literature with the patient's other doctors to see if they might be willing to reconsider the statin. And I can also educate my patients to say, all of us on your healthcare team, we may have different opinions about whether or not you should take a statin. We are all advisors. You get to make the final decision. It's up to you whether or not you want what you think of this risk versus benefit. This is your life. You get to, so listen to all of us, do your own homework, and you decide,